teachers and staff. It is Thursday, July 9th, and I just wanted to give you a brief update on what we've been working to re-enter schools. But before I do that, I hope you are taking some time off, you are resting, spending time with family, and just enjoying the good old outdoors. I know I did that. I took a week off, and I feel so revived and so refreshed and just ready to reopen our school. So let's shift. Look at where I'm at. I'm at the front of the campus, and we are working right now to put some drainage in. And this portable classroom is going to be the new art classroom, as you know. Amber's moving in there, and we're putting in a stainless steel sink in there so students can wash their hands. She has access to water for art supplies as well. And then on top of that, we're installing some hand washing stations out here for our younger students. So there'll be 6 hand washing stations for our younger students to wash their hands throughout the day. And so I think the hand washing stations are really going to help with the safety of our campus and the health and safety standards. And so we're excited about that. And so I just want to show you a few other things that we're working on before I have Dr. Kane talk to you about our draft reentry plan and about maybe some of the concerns that I was hearing from you as we reenter. And I think it will help you feel confident about the direction that we are going. And again, I want to thank you for your partnership and the work that we're doing. So let's walk in and let's find out what's happening at Cold Spring School. So here I am in room 1, which this used to be a first grade classroom, and now we're converting it into a third grade classroom to meet the needs of our larger cohort of students. We are expecting to have 20 students this year in third grade, and so we want to be able to space them out 6 feet apart. And this is now going to be a third grade classroom, so it is in process right now as well. Let's see what else we're doing. So here I am in the new art classroom that used to be the Dolphin Center, our after-school program. As you can see, we moved the multi-purpose flooring to cover the carpet in here in case students spill. We also installed a new sink over there, again for access for water. So making moves in the art room. Let's see what else we're doing. So here we are in the old art classroom that is now being transformed to a 5th grade classroom. So as you can see, the flooring, we have the carpet is back. And we're moving some desks over here to meet the needs of our students. So let's see what else we're doing. So here I am in the former 2nd grade classroom that we're now converting to a 1st grade classroom to meet the needs of our 1st grade students. And so Stephanie's moving in here, and this will be her new classroom. Let's see what else we're doing. So here I am in what used to be a portable classroom that we, as you know, removed. And we're planning to build a garden out here, and we're still wanting to do that, and community garden, and we're thankful for all of our community partners who volunteered and put in a lot of time and effort and already to make this happen. But one thing that we're going to do is put out a hand washing station out here, which will serve long term anyway. We want to do that for students to wash their hands, and we'll have 6 hand washing stations out in this garden area right here. Now that you've seen a few projects that we're working on right now to prepare for re-entry into school, I want to introduce Dr. Kane to you all. As you know him as a parent of Cold Spring School, but he's also a surgeon and does a lot of work with Kaiser and educating staff there about the facts and myths behind COVID. And I asked him to share some of those facts and myths that he knows behind COVID to help us feel really confident in our re-entry plan as we move forward. So enjoy Dr. Kane's video and have a great summer.
Good morning, everybody. My name is Joseph Kane. I'm a physician and a father. I have an incoming daughter named Vivian Taylor Kane and a soon-to-be 2nd grader, Scarlett Ray Kane. We're living in unprecedented times right now, and I thought it would be really helpful for me to address the staff here at Cold Spring School, a place that I hold near and dear to my heart, about the coronavirus. Even though I'm a plastic surgeon by training, I am a physician administrator and leader locally in Ventura County at the Kaiser Permanente and the Southern California Permanente Medical Group. As such, I've done a lot of training kind of ramping up and talking about surge planning for coronavirus. And if anything I've learned, it's that communication is really, really important. Being open about what you know, what you don't know, and some of the early learnings. And so today I would just want to go really briefly about where we are, how we got here, and where we can go best foot forward. So the coronavirus, just very quickly, high level, coronavirus is named because it's got a crown around it. It usually is responsible for anywhere from 10 to 15% of the common flu every year. Unfortunately, this is a different variant of the coronavirus called COVID-19. As you know, we were initially told that the coronavirus was first here in February in the United States. We actually found earlier reports doing some tracers and doing some genetic testing that the coronavirus got here in December. How are we now? How did we get here? Well, the coronavirus has been in the community for quite some time. Initially, the mortality rates were very high, and the penetrance, or the amount of people that had it, was thought to be very low. At that time, we didn't have enough testing capabilities, as you've probably seen on the news, and therefore, if you think about it mathematically, only sick people were showing up to the hospital and therefore getting treated. And when they got treated, it was oftentimes too late and they were intubated. Typically, when someone is intubated, regardless of the etiology or the cause of it, it means that their lungs are really in trouble. Their body is going through some type of systemic response, shock, if you will. And so you had these really sick people who were exposed, likely in the community or travel, whose immune systems were not able to fight the virus. This is very similar to the flu. Again, it's not the flu, but it's similar in terms of it's a virus and it has an immune response related to it that your body is responsible for. So, to finish the thought, when you have really sick people going to the hospital, but you don't have enough tests to check all the asymptomatic people, what it does is it inflates the mortality rate, right? Because you're not testing as many people. Well, now we have a lot of tests, and we found that there is a large community aspect to the coronavirus. So the coronavirus has been here for a very long time, and it likely will be here for quite some time until the vaccine. Many people are talking about vaccines taking anywhere from 16 to 18 months. And that's a really good idea for this version of the coronavirus. However, coronaviruses, like any other virus, mutate. A small mutation at the end in the envelope can change it and therefore not allow it to be completely effective for flu. So what do we do? I'm not saying all this stuff to be fearful or to elicit fear, but the basic principles ring true for the coronavirus, for the flu, or just bacteria. As teachers, you know this. Good hygiene is important. So, washing your hands, sing the happy birthday song, or whatever other variant you have. Tell your children to get under the fingernails. For yourself, make sure that you limit the amount of times that you touch your face. It's really hard. I probably have done it 3 or 4 times in this video. But if you do, just be aware of it and change your habits, or wash your hands more frequently. Masks. The masks are really important in terms of protecting other people from you. There's a lot of videos and reports about how far the coronavirus can travel. There was a lot of controversy of whether it was aerosolized, i.e. It required an N95, versus it being droplet, which means that it's large enough for that when you speak, it will go ahead and go out a couple of feet, sometimes 6 feet, and then land on the ground. And then there was a lot of information about how long can it live on surfaces. Cardboard can be several days. They found it on a cruise ship for 14 days. All of that's important, but it comes down to simple techniques of hygiene and disinfecting. So wiping down fluids, wiping down surfaces with any standard cleaning solution would be great. You can even use simple things like rubbing alcohol, simple green, even a soap. They found that the exterior portion of the coronavirus, it doesn't like fat. So if you disrupt it by just mild soap like Dawn or something like that, it will disrupt the outer coating of the virus enough for it to break and for the virus to no longer spread. So So let's go back. Hygiene, wash your hands as much as possible. Have the children wash their hands as much as possible. Cover your mouth when you're in close quarters. 6 feet. Try to maintain the 6 feet, although what we have found is that the 6 feet is slightly arbitrary. You've seen reports of people coughing in a grocery store and seeing it go from aisle 1 to aisle 7. Is that true? Well, possibly it's true, but it doesn't really, if you have a mask on, it should be okay. The other thing that we've learned is that viral load is super important. I mean, what is that? Well, it's the amount of inoculation, right? So it's like having someone come by who has just worked out and they haven't used any deodorant, so they have that musk smell. And so if you're right next to them and you give them a high five or an elbow bump or a hug, you're going to smell it more potently. Whereas if you're across the room, you won't. So that's the difference. So really when we've seen people getting sick, and specifically healthcare workers, it was because we didn't know that certain people had COVID or coronavirus, and therefore when we were intubating them, it was causing a huge viral load to the people treating them. Nurses, doctors, and even some of the environmental staff that were cleaning the rooms. That was a huge player. However, simple techniques, wearing a mask, disinfecting things, being cautious allows it so that you don't get the spread. There have been reports of the coronavirus spreading on surfaces or other things. That's very, 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 very low likelihood. It all comes down to viral load. The other thing that's super important is your own health, right? So we have found that generally healthy people don't get the complications related to coronavirus. What does that mean? It means that they don't die of coronavirus, right? And so if you look at Los Angeles County, 90% of the deaths in Los Angeles County were for people, either young or old, who had comorbidities. So that means their lungs, their heart, their immune system didn't work. So I want to just display some of the fear that's out there. If again, we go down to hygiene, disinfectant, and your own health would be important. How can you take care of yourself? Well, sleep is super important for the immune system. I didn't get much sleep last night, and so I'm faltering on this. That's okay. I'm a doctor. That comes with the territory. But 8 hours is recommended. And if you have troubles with sleep, please go on and find the meditation app, or Calm, or turn off your screen. Get blue light blocking sunglasses if you have to do computer work. But just maintain. There's so much information about the sleep out there. It's so important. Just get your 8 hours. Exercise. Please just get 20 to 30 minutes of exercise. Get your heart rate up. If you've got bad knees, go for a quick walk. It doesn't matter. Just get some exercise. The other thing too is just socialization. Well, talk about being socially distanced. That's important. But have the physical distance and keep the social stuff the way it should be socially, okay? The other thing is maybe talk about micro bubbles. Maybe you can have conversations about people that you know and trust, that you could create a bubble and say, look, we're only going to go to these certain areas and you can only go to these areas, and maybe we can get together and we can relax a little bit. Again, you can still wear your mask, still wash your hands, but take some of the fear away of things. The other thing too is specifically in the classroom. How do you do all these things in the classroom? Well, it goes back to the same principles. So we just got an emailed question from one of our viewers. And the question was, what do we do in closed spaces where there's either poor ventilation, good ventilation, or no ventilation? And so I'll tell you a little anecdote. When I was planning for the first surge in the COVID virus, or the coronavirus, COVID-19, in February and March, what we were trying to do is to divide our medical office building into people who had respiratory symptoms and therefore could have coronavirus, and those who didn't. And what we found is that when we went ahead and we sequestered those patients who possibly had coronavirus into our urgent care setting or into some of our medical offices, there was a lot of fear about ventilation. There's a lot of fear about, well, these patients should be in what's called a negative pressure room. And a negative pressure room is just that. It is a vacuum, so that when you walk in, it's sealed. And what we have found is, it didn't make a difference. So we had only 3 exposures to healthcare workers in our medical office building, and that's seeing hundreds of patients a day over the course of 4 months. And 2 of those exposures were documented to be to be gotten or to be acquired in the community. They were not done in the hospital. So that begs the question, what is the ventilation? What is actually needed? Again, the coronavirus is circulating. It's circulating in restaurants, it's circulating in bars, it's circulating in the grocery store, it's circulating probably in the classroom, but it doesn't necessarily mean that you're going to have a higher risk of getting it if you are in a room that's well ventilated, poorly ventilated, or no ventilation. It comes down to the basic principles: hygiene, wash your hands, disinfect surfaces, and wear a mask when possible. And maintain, if you can, some appropriate distance. So the COVID elbow, the fist bump, no hugging, and that's a difficult thing to do, but I think we got this. So we just got another question through some of our viewership about the 6 feet. And that is very challenging to implement. It's important to try to do, but in our medical office building setting and other places where there's essential workers, gas stations, grocery stores, classrooms, it's really difficult to get the 6 feet. What you should note is that the 6 feet is a requirement by some and a guideline by others. We don't have a lot of science around it, except the idea is that just create a buffer. So what to do what are some ideas to maintain the 6 feet? I'm happy to discuss that offline. But please know that the 6 feet is something that conceptually is meant to protect people and to prevent them from having close contact. What you'll find is that if you go to different institutions, you'll see an X on the ground, and again, that's to demarcate the 6 feet. Oftentimes people are not standing right on that X, and so you wonder, well, if they're a foot off, does that make a difference? Does it not? Again, there's a lot of fear around this, and I don't know the best response at this time, except to say, try to maintain some distance, and if you get close to somebody, that's okay. Just go ahead and wash your hands and disinfect even more appropriately.
Thank you, Dr. Kane, for being with us today. I know you didn't get home until 4 o'clock in the morning, and then you were here 3 hours later, and I appreciate you taking the time out of your busy day to really help educate the Cold Spring School community and to really help us as we plan and move forward as we re-enter school. So thank you again, and we appreciate you and your entire family.
Here we are in the front office, and as you can see, we've installed a glass partition to protect Coral from visitors, and we have a little area to exchange materials as well. Here I am sitting behind one of the plexiglass partitions that we've ordered to be placed on every student desk. So we actually are in the process of assembling these, so we need a lot of volunteers in this regard, but one of these plexiglass partitions has been, will be provided for every student desk, and this will really help whenever you need to get close to a student to serve as an extra protection for you and the student. So this is what it looks like. We also have ordered a few really fun items to help with students in being able to identify staying 6 feet apart, such as this huge sticker and some tape, some safety tape, which again, 6 feet is distancing. So a few fun items like this that are coming to support the information needed to let everyone know to stay 6 feet apart. We also have some PPE equipment for every teacher and staff member, such as a face shield that goes on like this for you to use as an option while you're teaching or working with students. Also, masks. The masks haven't arrived yet, but here's my mask that you can wear. Make sure it covers your nose. Make sure your entire face like this, it's secure. Here's mask. As well as hand sanitizer for every classroom. That's like this. Use it to disinfect your hands. Woo! And then per your request, I know you asked, to receive your own set of cleaning supplies for your classroom for you to use whenever you felt like you needed to use them. So in honoring that request, we purchased buckets for all your materials, cleaning disinfectants to go in here, such as wipes and soapy water and some disinfectant spray and some rags. And you'll each have a bucket with your own supplies that you can use whenever you feel like you need to use them as well. So again, we are working hard over here because I know that you're going to be working really hard for our kids, and thank you in advance just for your flexibility because things keep shifting and changing, and but we're preparing to re-enter school on August 18th, and really looking forward to being together as a community again. So have a great summer, everyone.